Hello everyone, my name is Aaliyah. We have Kylie over here and Amandi. Our main focus for today is going to be healthcare, so we're going to be talking about a lot of different topics, but mainly just involving healthcare.
Yes, okay, just to strongly start off, the broad healthcare sector has been wildly underperforming the S&P 500, flat in 2024, while the S&P returned roughly 25%. And in 2023, healthcare again was roughly flat, while the S&P returned roughly another 25%. And this is highly unusual. While the healthcare sector can trail the S&P from time to time, it hasn't had such a vast decline of about 53% since at least 1991. And I am claiming that these deviations are from short-term headwinds, the Republican administration getting into office, Robert Kennedy being openly anti-vax, and Food and Drug Administration scrutiny, and then the pharmaceutical imports being tariffed by 100 to 200%. So all of these are potential reasons why the healthcare sector has been underperforming. But again, I believe that allocating to this defensive sector is, a good time to do so because reversion to the mean can be near. And additionally, a lot of investors have been turning away from risk on assets such as crypto, which has wiped out its gains year to date, and other speculative AI and big tech companies have been making investors seek more safer sectors. So I'm going to go ahead and end that thought.
So I want to talk about private equity and their involvement in healthcare. So just to start off, some names that filed for bankruptcy that had been owned by private equity were Steward Healthcare, formerly owned by, hopefully I'm saying this right, Cerberus Capital Management. They had filed for Chapter 11 bankruptcy in May of 2024, with over $9 billion in liabilities. Also, Prospect Medical Holdings filed in January of this year, 2025. Also, Cano Health. So this is to basically highlight private equity turning hospitals into profit-focused entity and less on, patient care. Go on some more big names right now that are not bankrupt, but Apollo owns LifePoint Health, Ardent Healthcare Services, owned by Equity Group Investments, and Surgery Partners by Bain Capital. So I wanted to focus on implications for, again, just focusing on patient care, so access to services, staffing shortage, and basically overall morale among employees. Also, healthcare costs being cut, so meaning certain treatments or medicines for patients are not going to be as available as they would. So this would just kind of suggest that there's going to be more deaths in
This is fatal.
Yeah, fatal. I did read an article that was just suggesting that these hospitals could face higher mortality rates just on inefficient care. Also, to understand some more of these controversies, basically these private equity firms are using their leveraged buyouts to squeeze out these hospitals for as much debt as they can hold before they basically crash and burn. And just with the goal of boosting short-term financial performance and then selling for profit where they can.
I would say also to just quickly add is, while the nature of private equity is very capitalistic, and kind of how we were talking about earlier, how the loophole is that these privately owned healthcare companies are underregulated and therefore they can get away with more stuff. The public-private equity firms, I don't know if that's Apollo, for example, who's publicly traded. I think if anything goes wrong with those hospitals or healthcare facilities, I think that's kind of when it will finally get back to them in terms of regulation. So it would just kind of be a domino effect before it actually gets fixed, rather than a publicly owned healthcare facility having immediate and quick regulation, and these items that you're talking about being more monitored and having better quality for the patients. Being more immediate is like going to be less immediate with the privately owned ones.
To kind of build off of that, legislators are seeing this kind of trend as more concerning. So by late of this year, 2025, at least 7 states, including California, Massachusetts, New Mexico, and Oregon, have all passed some laws aiming to basically increase oversight and transparency for these hospitals that are owned by private equity. So yeah, with these laws, to be a little more specific, it's just kind of notice of acquisitions, basically like with PE roll-ups and stuff like that. And then also just to limit the influence of non-clinical investors kind of affecting care decisions for patients, like I mentioned earlier, because again, that's not for a patient's benefit and more for profits and leaving everyone else in the dust. So that's what a lot of people are worried about. And for some stats, I had also found approximately 488 US hospitals are owned by private equity firms, representing 8.5% of all private hospitals in the country and about 22.6% of all for-profit hospitals, with they named Texas as the most private equity owned hospital, with 108 in total in that state. While this is a growing concern and just like a smaller trend that's occurring, I think with legislation kind of adding some restrictions within like acquisitions and also basically advocating for more transparency kind of shows that there's definitely a boundary that they're crossing when going into patient care, and especially if they're giving like large amounts of investments, they would definitely have more control over patient care, and that's not something that they want to cross the line with and make it just, Kelly was saying, like capitalistic.
I mean, I think it's a pretty interesting topic, especially because the reason why these private companies enter the healthcare space is to essentially help these failing, or to like rescue these failing healthcare systems and like support practitioners essentially. But I mean, you could see like it's essentially the opposite when they, when there's a higher turnover rate in terms of staffing, or when there's lesser access to care and high health care prices, and just overall poor medical outcomes, as earlier mentioned, increased deaths and high rates of complications because of this. So they come in to resolve some issue, but instead they create more problems for the patients in turn. And yeah, I think if there's more transparency in regulations, this could be prevented as well.
Yeah, and I think for private equity's defense, as long as there is some like guidance, I think it could also be really good. This could improve healthcare delivery by, these large investments that these struggling hospitals are getting, to basically drive operational efficiencies and expanding services, again, that are currently struggling. So I think it could be something that would contribute greatly to these hospitals, but again, it's based off of, I guess, motivations behind these investments and where they see like the goal actually going. So yeah, I don't think it's totally terrible, but regulation definitely is needed before this trend continues to pick up.
Mm-hmm. And then is this also when you had talked about the aging population, or did you talk about?
Yeah, see, I'm missing out.
No, it's okay.
Yeah, so earlier I was saying that with the healthcare sector kind of performing not as well in comparison to the S&P, a huge driving force is the aging population that a lot of people aren't talking about. And with Trump's immigration policies, it does make sense that with less working people, younger working people coming into the country, everyone is getting older. So I agree that it's a driving force for healthcare overall. So I think it's a great opportunity to enter. And I think we were also talking about jobs being a huge concern right now, but we have seen healthcare really prevailing and jobs growing within that. So I think that's why we mainly saw healthcare as a good opportunity right now.
Absolutely. It's definitely a promising sector and definitely undervalued right now. And I brought that up also because it kind of segued into my random thought of just experiences at work where, you know, the financial advisor is talking to the client and say they are retiring at 60, the software is projecting for the men to live until age 90 and the women or 91, and for the women to live until 95. And oftentimes these advisors have to explain to people that their money needs to last them 30 plus years, but most people are not anticipating maybe that they're even going to live that long. And this is where healthcare becomes even more important as the population is having a higher ending age. I don't know how to word that, but
with like AI and everything, like more efficient like treatments.
Absolutely,
and,
yeah.
The age of people living just increasing.
Exactly. And also AI in healthcare is going to be revolutionary again because, I mean, if big tech companies are getting so advanced, it's going to be so important that healthcare keeps up with it.
Oh yeah, and then also people getting diagnosed early.
Yeah.
I think that's also great for healthcare overall. People getting the treatments that they need earlier, and then expanding their life
expectancy. Yeah.
Life expectancy, that's the word.
Yeah, I actually did read a little bit about that, where these AI tools can track these patients' like history and results and the new data that's coming in, and can project, you know, when they might need a new medicine or like early diagnosis, like she was saying. So I think that also will be really beneficial to just see how all the operational efficiencies will improve.
And I feel like with AI as well, it could like essentially help free up doctors more to focus on their like patients, and like they could like work on the back end and essentially create more efficiency in the hospitals as well.
Kylie, what are I'm so curious, what are HSAs?
Thank you for that perfect segue, because I am going to explain what an HSA, aka a health savings account, is. And you know, because we're on the healthcare topic and because I love wealth management, we are going to talk about why an HSA is so advantageous that it has a triple tax benefit that you do not often see. So first of all, your contributions are tax deductible. They can come out of your payroll pre-taxed, and the growth is tax deferred. And then as well as the withdrawals are also going to be tax-free if used on qualified medical expenses. And this is really important for everyone to learn about because it can be used for doctor visits, some over-the-counter medicines, prescriptions, dental and vision care, mental health, etc., etc. But there are some contingencies that do apply to these accounts. You must have a high deductible plan with your employer, and these accounts also have contribution limits that do change annually, so that is something to be aware of. And then also they don't have a like use it and lose it rule where if you put money in the account you have to use it by the end of the year. No, you can take this money into the new year, and even if you change employers you can roll it over into another account. So yeah, these are really important. And then also, if you do withdraw money, it is important to know that you will be taxed at your normal income tax bracket, and then in addition, you will also be taxed by 20% as a penalty if you are not using them on qualified medical expenses before the age 65. But yeah, I just wanted to highlight this account and just throw that in there. That's really important to know about and potentially invest your money in.
Part of Trump's big beautiful bill, they are also creating these Trump accounts for children born US citizens, which is a new tax deferred investment vehicle for these kids, basically promising $1,000 of contributions being entered into the S&P. Overall, just getting families to start investing early, but it doesn't start unless these parents open up these accounts for these kids. So I was telling Kylie earlier that this is also super important, but I was also saying that I see it as the Trump administration trying to basically address the whole Social Security issue of younger people right now being scared that we're not going to have enough left when we're older. So I think this would be great for people to start investing early and families to get more involved in the stock market, because I think Kylie was also saying that there's a lot of money like being transferred through generational wealth. And people that aren't in the stock market right now are at a huge disadvantage because that money continues to grow for those kids that continue to get this, transferred wealth. So yeah, I think that was it. Oh, and then also the founder and CEO of Dell Technologies had made a huge contribution of $6.25 billion, basically supporting this cause. And yeah. I also did find the White House had published an article basically going more in depth on this. They did state that this $1,000 contribution from the federal government could grow to $1.9 million by the age of 28 for this child. So I think that's pretty insane. 1.9 million, almost 2 million by 28 years old. They answer a couple of questions on this article. One that I think would be interesting is, do Trump accounts protect taxpayer dollars by preventing waste, fraud, and abuse? Basically what Kylie was saying earlier, these kids taking out the money right when they turn 18 and then blowing it all off before they can even use it for retirement or just more knowledgeable choices, I guess. And it says these accounts are built with strict safeguards to protect taxpayer funds. So they say they do that by requiring a valid social security number, limiting the one-time $1,000 contribution. So they basically only ensure that this goes to eligible American children, but yeah, it doesn't say that it's like a trust where you could basically restrict these funds until a certain age. I think it's just at 18 right now.
Yeah, deposits cannot be withdrawn prior to turning 18.
I have been hearing also people explaining that the social gap, the wage gap, whatever you want to call it, is growing. So the people that are getting wealthier versus lower income, kind of middle class disappearing. So I did see a Bank of America economist was talking about wage growth for lower income households dropping 1.3% year over year, and then accelerating to 3.2% for higher income households. This is after tax wage and salary growth by households.
I will have to agree that there is a huge transfer of wealth as, the generation baby boomers, are transferring their wealth into their extended families and children and so on. But also, I will have to leave, but I kind of did want to touch upon what the potential differences are between those accounts and then the custodial accounts that are also available, called UTMAs or UGMAs, which is basically where an adult can invest on behalf of their child and have some investments growing for them. But the controversy, or maybe the fact that it's not so suitable for most people, is because once the child turns 18, they can essentially just take the money and run or blow it all. And that's why a lot of people will invest into trusts or, other accounts where they can have more rules laid out on when the child can take this money, how much, and etc. So I don't remember what we had talked about after that, but maybe kind of learning what the other little rules are for those kinds of accounts would be good.
It also kind of ignores a pretty important segment of population, the lower income household. I mean, I don't think the lower income families are able to contribute $1,000 to $5,000 so easily. And so again, under this administration, this benefits the already middle class to upper rich class more than meeting the needs of the lower income.
Well, they, just to clarify, they do give the $1,000, like, to start out. Once the parent opens the account, they are automatically given the $1,000, and then from the Dell's contribution, they're given another $250,000, or no, sorry, not $250,000, $250 upon that. But like you said,
Oh, so the federal government will make an initial deposit of $1,000.
Exactly.
And then the families are required to make up to $5,000?
Not required, but they can. But that's where I think your point is totally valid, where higher income individuals are able to contribute more and most likely don't even need the $1,000 to start off with. Not saying that they don't deserve it, but I just think it definitely widens that gap, like you were saying, for lower income households that aren't going to contribute as much as higher income.
And over the long run, that $1,000 is pretty trivial. It's not economically trivial in the long run if it tries to keep up with inflation or,
Okay, and that is going to basically conclude the end of our podcast. I hope you guys enjoyed, and if you guys have any more questions, definitely reach out to us. But other than that, thank you.
Thank you.